Today we are going to look at somebody asked me this question about having fluid in the uterus. So if you are here and you are the person that is suffering from this, I want you to pay attention. Listen to what I'm going to be saying about this fluid. You will know whether it's exactly what you are suffering from. You know, sometimes when doctor tells you that you have fibroid, you have cysts, your tubes are blocked, you would think that it's worst. You may have cysts. It depends on. That's why if you tell me you have something like this, you have fibroid, can I get pregnant with fibroid? Can I do this? I will ask you, what is the size of the fibroid? Where is it located? All these things plays important role. So you need to listen very well to know whether and to know the type of fluid you have, whether it is the one that requires immediate attention or the normal fluid. So I don't know if the person that asked this question is here or anybody that is experiencing such thing. You should pay attention to know, because if you are listening to what I'm going to be saying, you will know the symptoms and how you are feeling. So now this fluid, a little fluid is normal. When you have fluids in your uterus, is normal. Some of them are normal because after your ovulation, the leftover fluids there, they may come out normal. Now, you are going to be listening when you should seek for doctor's attention or when it is no longer normal fluids. A little fluid is normal, but if it contains pus or blood or causing pains, there may be a bigger health problem such as infection, pregnancy complications, or health conditions such as endometriosis or fibroid could be the cause. It is also possible that a cyst, a follicle, or the uterus itself has ruptures, that is burst. Everything from leftover menstrual blood to normal bodily secretion can cause fluid to appear on a ultrasound. Now, like I said before, when will you know that this fluid that is in your uterus is no longer normal fluid? For example, every month, every woman is supposed to ovulate. That is the release of egg. And when that egg is not released, that is formula cyst, when it is not released that month, then it's going to be disintegrating. That is, how will I put it? It's going to be breaking. It's going to be breaking and be coming out within 3 or 2 of your cycle. So in this situation, if you see something like that, it is normal as long as they are not causing you pains. As long as they are not causing you pains. But in a situation where you are having pains, then you know that this fluid could be infection. It could be infection, it could be pregnancy complications, or maybe you have endometriosis or fibroid. These are the causes of these fluids in your uterus. I repeat again, normal fluids, a little fluid is normal. When it is little, it's not paining you, it's not causing you any harm, you are not feeling discomfort, you don't have pains in your pelvic, that is, the fluid is just coming out, it is normal. But in a situation where it is causing you pains, making you to be uncomfortable, then it could be as a result of infection, could be as a result of a fibroid, it could be as a pregnancy complications, it could be a result of endometriosis. We treated it on Monday. I think it was the endometriosis that I treated on Monday that I wasn't considering. So now, how would you discover this cyst? How would you know, did I say cyst? How would you know this fluid? When the fluid becomes uncomfortable for you, please visit your gynecologist or your healthcare provider. He will check it through ultrasound. In that ultrasound, they are going to see where it located, the size it. So this is how you are going to find out the type of fluid and what is causing the fluids. Now let's look at the symptoms of these fluids. How would you know, or what signs will tell you that you are suffering from these fluids? Number one is pain, possibly severe, especially in the pelvic area. Like I said before, if you are having a little fluid, that is normal. As long as it's not causing you pains, it's not making you uncomfortable, that is normal. But in a situation, symptoms, now we are talking about symptoms of fluid in the uterus. How would you know all these things? One is pain, possibly severe, especially in the pelvic area. Number two, you'll be having fever. Are you having fever? Another one is fatigue. That is tiredness. It makes you to feel tired. Another one is irregular menstruations. When this fluid fill your uterus, you will notice that your menstruation will not be regular. It will be preventing your monthly regulation and menstruation. And you know that when your menstruation is not regular, you will not be ovulating. Any month that you did not menstruate, just bear it in mind that there is nothing like ovulation. Another one is pain in the lower back and pain in the lower back. Are you feeling pain in your lower back? Another one is pain during sexual intercourse. If you have cysts, if you have endometriosis, if you have fibroid, if you have PCOS, the most common signs of all this is you will be having pains during your intercourse. When the cyst is big, like I said before, it's not every cyst that affects you. Some people misunderstand it. Maybe they will go to the hospital. If you go to the hospital or you undergo ultrasound test, they say you have cyst. The next question you should ask them is, what is the size of the cyst or the name of that cyst? If it is formula cyst, if it is follicular cyst, it's okay. But you see diamond cyst, then that one is the one that calls for alarm. That one is the one that will make you to have pelvic pain. That one is the one that will make you uncomfortable. That one is the one that will make your monthly bleeding to be bleeding too much. So I believe somebody out there is noting what I'm saying. So now another way that you can notice that you have this fluid is unusual vaginal discharge. You'll be having some vaginal discharge. Sometimes it may be smelly, sometimes it will be irritating you that is seeing it. So now another thing we are going to look into is how to remove these fluids from your uterus. How do you remove it? There is different kinds of fluids. When you go for a test, they will look at it and they will diagnose the area it falls. For hydrothermal obligatory, this is medical terms. I don't know if you people will understand it, but I looked for a way to cut it, but I think you should ignore this, but I need to say it. For hydrothermal obligatory, your provider will put heated liquid into the uterus. They will heat something. They will put heated tube into the uterus through a canal, and what they will do is that they will pump the liquid. I don't know how to demonstrate it. Maybe one day I'm going to bring out the video on how to do it. They will pump it around your uterus to destroy the lining, to destroy those fluids. As they are doing it, the fluid will be, the thing is just like something like balloon that is filled with something. As they are doing it, they are destroying the lining. After the procedure, your provider will pump any fluid out from your uterus and remove the instrument. So this is the first step in which you can use to remove it. This one must be done in the hospital by a healthcare provider, by a gynecologist. You cannot do it yourself. So another remedy for fluid in the uterus is drainage. Sometimes they will use something to dredge out the excess ammunition fluid in your uterus. Another one is medications, of which I'm not going to mention here. There are some medications that you will take, oral medication that you can take to help reduce further urine production, because you know, as this fluid is filled there, it will be it will be suppressing your bladder, making you to be urinating frequently. So this is all about fluid in your uterus. The question for you now is, you need to identify the type of fluid you have. Do you have pains? Do you have discharge? Do you always have pains that is severe in your pelvis? Do you have pains during your sexual intercourse? Do you have discharge that is smelly? Is your menstruation irregular? Now, this is time for question. I don't know if anybody have question regarding to what I've just talked about now. Where is this from? I don't know if anybody have, okay. I don't know if anybody have question. If you have question, please. God bless you for Oduwale Franca. Oduwale Franca, thank you for that compliment. Please, this is time for question. If you have question, please ask. Please ask your question. Nobody is asking. Nobody have question today. Nobody is asking question. Nobody is asking question today. So if you have fluid, you should find out the type of fluid you have. Please, my lower back also could it be the sign of fluid? Yes, whenever you hear pelvic have something to do with, do you always have fever together with this? So, okay. Please, mark, can someone with ovarian cyst take? Yes, folic acid, I have said it before. Folic acid is It's prenatal vitamin. Is not a harmful medication that can harm you. As long as you are trying to conceive, you must. Folic acid is a necessity. You must take it 3 months before you start planning to conceive. So it's a must. It's a must for any TTC mother. Folic acid is a must, and it doesn't harm you. Whether anything you have, whether fibroid or this thing, it doesn't harm you, and it will even help to prepare your womb. So you need it. Like my sister, she got fibroid and cyst. Also some fluid on the womb. She always having pain on her lung. Yes, who is this? Beyonce Muri. You will tell your doctor to visit a gynecologist, especially those ones that have, I know, which country are you? If it is here in Europe, they can easily identify it. Whenever you go to your doctor, they use ultrasound to check your womb, so you don't even need to tell them that you have it. They will be the one to identify it. But in Nigeria, I don't know if, I think there should be a hospital that have ultrasound. Then they should check her and fibroid and cyst. Fibroid and cyst together. She will be passing a lot of pains. She will be passing a very big pains. Fibroid is something else, let alone combining together with a cyst. So my advice to her is that she should go to her gynecologist, or any what I mean by good gynecologist that can, you know, tender her very well. It will be good. At least they will check and remove the fluid first. Then, okay, she's in Europe. Yeah, it's very good for her now. They can, even the fibroid, they can remove it. If she's in Europe, she's in safe hand. Okay, Chuku Jennifer. Okay, I'm fine. And you? Please, ma, what is? Tuberculosis is sexual infected. Tuberculosis is a disease. It's an infection. Tuberculosis, especially people in Nigeria, suffers from it. So, if you say you're supposed to see it on the first, today is second, it's too early for you to experience those signs. So you need to wait a bit. It could be that you are pregnant. You need to wait and see some signs. You must see a sign that will show you, as long as you miss your period, like you said, it's supposed to come yesterday, it didn't come today, is second, you need to give it time. Because sometimes stress can hold your period. Stress can make your period to be delayed. It can even seize it for the whole month. You cannot see it. So you need to, but I pray it comes positive for you. Please, if I miss your question, you re-ask it again. Please, my camera. Someone with overdose. I thought I have read all this thing. Okay. There's one question, please. What causes menses to stop after the after what? D&C. After D&C, why did you do D&C? Please, anybody that is doing D&C, I don't like that word. I don't like it. If you did D&C and it didn't come out, it could be maybe infection, or you know, D&C is just like you give birth. You give birth despite the part that you didn't deliver the child normally. You were pregnant, right? And you did D&C. It's the same thing that you give birth. So your body needs to, you don't expect to see your period. Some people, when they do it, their menses will come back. Some, it will take time for your body to rebuild itself. You are just like somebody who who give birth. So that is it. Sarah, I'm good.